We now have a plan for COVID-19 in our country, and we each have a part to play. This evening I want to talk about how each of us can live safely with this virus over the coming months. In recent weeks, we've seen a significant increase in COVID-19 cases, hospitalisations and sadly deaths across Ireland. Donegal now has the highest 14 and 7-day incidence rates in the country. Specifically, its 7-day incidence rate is 108 per 100,000 population, which is more than double that in any other part of the country outside of Dublin. While there have been cases widely distributed all across the county, there has been particularly significant disease activity in the Lifford and Stranorlar areas, with a 14-day incidence of 336 per 100,000 population, the highest in the country. Given the speed at which the situation deteriorated in Donegal, NPHET yesterday recommended the application of Level 3 measures to the county. We fully understand that this recommendation may be challenging for people in Donegal. However, it has been made to protect public health and to prevent a further worsening of the situation there. Unfortunately, the situation also continues to evolve nationally. In the last 14 days, there have been over 3,700 cases notified across the country, and our heat map of cases is showing that many counties are now turning red. Today, I am asking people everywhere, but particularly in Donegal and Dublin, and more broadly in Louth, Kildare, Wicklow, Cork and Galway, to pay special attention to the public health advice. I ask every individual to take personal responsibility to prioritise who you need to see, limit the size of your social network and reduce your social contacts over the coming days and weeks. Because while there is every chance that other areas in the country will have to move to Level 3, there is nothing inevitable about that. We have seen previously in Limerick and Tipperary, and possibly over the past few days in Waterford, how people working together can take control and turn the tide on this virus. But even in these counties, people need to keep going, keep making the right choices, and deny COVID the opportunity to transmit. This is a marathon, not a sprint. It won't be easy, but over the coming months we have to learn to live with COVID rather than try to battle against it. We all want to get on with school and education, with providing other very important healthcare services, with playing sport and going to work, but we have to do all of these activities safely. Our challenge together over the coming days and weeks is to respond to the evidence of the virus in our communities, and in doing so we will protect ourselves, our families and our communities. Do not underestimate the value of your individual actions. So please stick with this, and together we will get through this. Thank you.